Imagine a sudden severe headache, unlike any before. Your neck stiffens, fever spikes, and light becomes unbearable. These aren't just flu symptoms, they could be the first signs of meningitis. Meningitis is a medical emergency that can turn a healthy person critically ill within hours. It's the inflammation of the membranes around the brain and spinal cord, and it can cause permanent damage or even be fatal. The clock starts ticking with the first symptoms. Every minute counts. Anyone can get meningitis, but infants, teens, and young adults in close quarters are at higher risk. The disease can progress so quickly that someone may seem fine one moment and be fighting for their life the next. That's why symptoms like severe headache, stiff neck, and fever must be taken seriously. But there is hope. Vaccines and antibiotics can save lives. Knowledge is our best defense. Recognizing the signs and acting fast can make all the difference. By staying informed, we can protect ourselves and our communities. The race against time is real, but it's one we can win. Stay vigilant, act quickly, and help save lives. Meningitis is the inflammation of the meninges, the protective layers around the brain and spinal cord. When these membranes swell, pressure on the brain can cause severe lasting damage. The most dangerous form is bacterial meningitis, caused by bacteria like Neisseria meningitidis and Streptococcus pneumoniae. Viral meningitis is more common but usually less severe. Rarely fungi, parasites, or even certain medications can trigger meningitis. Identifying the cause is crucial, as it determines treatment and urgency. Meningitis germs often spread through respiratory droplets, coughing, sneezing, or sharing drinks. Outbreaks can happen in close living environments like dorms or barracks. Any suspected case must be treated urgently to prevent severe outcomes. Vaccination is our strongest weapon against meningitis. Routine childhood vaccines like Hib, pneumococcal, and MMR protect against key causes. Teens and young adults need the meningococcal vaccine, especially before entering communal living. Different vaccines target different strains, so staying up to date is vital. High-risk groups, like those with weakened immune systems or travelers to certain regions, may need extra protection. Good hygiene also helps. Wash hands, don't share drinks or utensils, and cover coughs and sneezes. These simple steps, combined with vaccination, dramatically reduce risk. Prevention is always better than cure, especially with a disease this fast and dangerous. Talk to your doctor about which vaccines you and your family need. Protect yourself and those around you. When meningitis is suspected, doctors act fast. Every minute matters. Classic signs include fever, headache, stiff neck, and light sensitivity. Diagnosis often involves a lumbar puncture to test spinal fluid for infection. Blood tests and scans may also be used to confirm the cause. If bacterial meningitis is likely, antibiotics are started immediately, even before test results. Viral meningitis usually requires supportive care, rest, fluids, and pain relief. Fungal meningitis needs powerful antifungal drugs. Hospital care is often necessary to monitor and support vital functions. Early, aggressive treatment is the key to survival and recovery. Quick action saves lives. Surviving meningitis can leave lasting effects. Hearing loss, memory problems, or emotional changes. Ongoing medical care and support from specialists are often needed for recovery. Families may also need help coping with the aftermath. Support groups and organizations offer vital resources and community. Awareness, vaccination, and quick action are our best defenses. Make sure you and your loved ones are up to date on vaccines. Know the warning signs: severe headache, stiff neck, fever, and light sensitivity. If symptoms appear, seek medical help immediately. Don't wait. By staying alert and informed, we can protect our communities. Together, we can turn the tide against meningitis. Act fast, save lives.